KwaZulu-Natal was the first province in the country to record a coronavirus case early last year and continues to be one of the leading provinces with the highest number of active COVID-19 infections. During the second wave of the pandemic, the most affected areas included eThekwini, Mgogundlovu, Zululand, Mkanyekude and Umzinyathi districts. The province has over 160,000 healthcare workers eligible for vaccination. These include 81,000 healthcare workers in the public sector and 49,000 in the private sector. But experts are of the view that the Provincial Department alone will not be able to distribute the vaccines across the entire province, and that the community healthcare workers are vital as they can be trained to be vaccinators.
My concern really is in terms of the healthcare workers who are not necessarily your professional healthcare workers. So community health workers, for example, they are so important, and we're going to have to think about how to make sure that we get the vaccines to them as well. Chances are they may get it through the clinics, but in my view, they are also going to be important as vaccinators. I don't think that for a province like KwaZulu-Natal, we should only expect professional healthcare workers to be vaccinators. We need to be able to broaden our capacity to train people to become vaccinators. Getting them vaccinated in phase 1 is not a problem, and I don't see a major problem there. I think the problem is going to come when we have to go to phase 2. And in my view, we need to start planning phase 2 now.
Phase 2 will include 16 million citizens, among them essential service workers, people with comorbidities, and the elderly. This would see a minimum of 67% of the population vaccinated, achieving critical herd immunity from the virus. The current AstraZeneca vaccine comes in a 2-dose format, administered between 4 and 12 weeks apart. In the province's outlying areas, where clinics are often far away and hard to reach, monitoring compliance to the second dose will be critical. Moshabela says that in these cases, the local manufactured single-dose Johnson & Johnson vaccine may work better. However, it may be noted that the vaccine efficacy here is lower for the 501Y V2 strain of the virus.
It can be stored at low temperatures, 2 degrees to 8 degrees. This is normal fridge, and we do that all the time. So even in far-flung areas, we can get vaccines at that temperature there. So then storage is not a problem there. The second thing is that it's single dose. It does not require 2 doses. You give 1 dose, that's it. And that is also the right vaccine for those kind of areas, because then chances are you might see a person once, you might not see them again for so many other reasons. Access might be difficult, costs of traveling and so forth. So if you can get them, you see them once, you give them a dose which is stored at the right temperature that is accessible, then it's okay. You capture them in the system, that's it, done. Don't try and find them again after 8 weeks. That makes it very difficult in remote and rural areas to access people. You can use those kind of vaccines in the urban areas and other places where it's accessible.
NGOs are also calling for increased transparency to ensure the rollout's credibility.
It's important that government takes people into their confidence. And then the second thing is that participation in the rollout is really key. And that's in both rollout planning and implementation. Part of what makes our HIV program work is that people living with HIV and activists are co-creators of the plan, and they monitor implementation. And that's a really important part of securing buy-in into a plan and ensuring that there's no hesitancy and no distrust. So I think those 2 elements, participation and transparency, are really important to making sure that there is credibility and trust in this process.
Since the beginning of the pandemic, over 7,400 health workers in the province have contracted the virus. 57% of nurses and 6% of doctors have been infected. Despite the rise in infections among healthcare workers, The Provincial Department of Health says it has not employed additional personnel to be vaccinators. A provincial depot has also been set up in eThekwini that will dispatch to vaccination centres in the various districts.
We didn't have to employ new people, however. It is the nurses that we have in our different hospitals. It is the nurses that we have in our different clinics. Right now we have trained over and above the ordinary nurses that vaccinate our children. We have trained more than 2,000 nurses to ensure that we don't run out of human resource when phase 2 and phase 3 come in particular. There will be vaccines that are going to be held at our provincial depot which is here in eThekwini, but each and every district is also going to have its own center that the vaccines are going to be delivered directly to.
The province has established its Provincial Command Council. It will focus on building vaccination confidence through addressing medical, religious and cultural concerns.
The Provincial Command Council will support, monitor and perform oversight over the vaccination process, especially the rollout. We have phases as cascading from the national plan. And phase 1 is divided into 2. That is focusing on staff in direct contact with patients. And these are healthcare workers and support staff. 2, staff not in direct contact with patients, and these are administrative and other staff members.
The province has identified 91 vaccination sites that includes public hospitals and community healthcare centres. Jayed-Leigh, SABC News, Durban.